Hi, everyone. Thanks so much for joining us today. My name's Callie Hassinger, and I'm a financial planner here at the Center for Financial Planning. Today, we're going to be discussing a very important piece to your retirement plan, which is, of course, Medicare. It can be easy to feel overwhelmed by all of the Medicare options, whether you're just enrolling or trying to switch out of a supplemental plan, which is why I'm so excited to be joined today by a Medicare expert, Jim Edge. Jim works for HP1, and Raymond James has recently partnered with HP1 to provide our clients with access to agents who specialize in Medicare. And these agents can help our clients select Medicare coverage or supplemental policies based on your needs. Jim's going to take us on a little crash course on Medicare here today. He'll explain the different parts, what they cover, and then he's also going to touch on a few changes on the horizon and what coverage you're responsible for electing and maintaining. Jim, thanks so much for your time today.
Thanks for having me on, Callie. Thank you all for joining the webinar. As Callie mentioned, I'll cover quite a bit today and keep it around 30 minutes for you. You may know some of this information, and hopefully you can walk away after this being a Medicare expert yourself. We'll dive right in. Health Plan 1, or HP1, we've had a partnership with Raymond James for about 2 years now. We've been around since 2006. We specialize in Medicare. We do help or give some assistance with some ancillary products to help bridge certain gaps of either what Medicare doesn't cover and at least some advice or guidance on where to go for the under 65 market or the Affordable Care Act. I'm going to spend a few minutes here on this slide going through just what Medicare is and what the coverage options available to you are. And so typically with Medicare, you have 3 options or 3 different paths that you can go down. And this is excluding if you have employer or group coverage, union coverage, VA, or TRICARE. That could be a whole separate presentation. So we'll put that on the side and say, assuming you don't have that, here's what's available to you. The first option you have is just sticking with original Medicare by itself. It comes in 2 parts. Part A is going to cover if you're hospitalized overnight, inpatient hospital care. Part B, as in boy, is going to cover your medical. That's doctor visits, outpatient surgery, lab work, most services not being inpatient in a hospital are going to fall under Part B. And the reason that the 2 are separate from the federal government is that you have separate deductibles you have to meet before Medicare will pay anything. So if you're hospitalized overnight under Part A, you're going to have a $1,340 deductible. Let's call it $1,300 that you pay day one. And for your medical deductible, you're going to have $183 that you pay. These are annual deductibles. Now, after you meet these deductibles, Medicare will come in and they will cover 80% of your bill. Pretty easy math. You're left financially exposed to paying 20% of whatever your bill is. A $100 doctor visit would cost $20. A $10,000 surgery would cost $2,000 for you. And there's no cap on that with Medicare. It's 20%. Now, you will hear Medicare Part D as well. D stands for drug coverage. It's actually offered through insurance companies and regulated through Medicare. We're going to touch on that a little bit further on in this presentation. So for option 1 of Medicare, it's just having standalone or original Medicare by itself. You pay deductibles and 20% of your bill. You may add a Part D plan on the side for prescription drug coverage because Medicare by itself does not cover prescriptions. So that's option 1. Option 2 is to purchase a Medicare supplement plan. It's also called Medigap. That's the slang term. It means the same thing. A Medicare supplement plan is a secondary insurance. When you go out and you purchase through an insurance company, you pay a monthly fee or a monthly premium, and this insurance company will come in after Medicare pays, and they will pick up everything Medicare doesn't pay. So they can pick up your deductibles, they'll pick up the 20%. What you're worrying about is paying your monthly premium. Now, the only thing that a supplement plan does not cover is prescription drugs. So you would still want to purchase a standalone or a separate Part D insurance to cover your prescriptions. With a Medicare supplement plan, very important to understand that you can see any doctor or facility in the country that takes Medicare. As long as they accept Medicare, you're good with your supplement. There's no negotiated rates. And typically, when you're looking, and if you decide that this is the coverage you want, and this is comprehensive coverage, full flexibility, you want to be concerned with premium, because the companies offer the same types of coverage or the same exact coverage, but their premiums and monthly fees can be vastly different, paying for the same thing. You still want to go with a reputable company, one that's been around, a recognizable name, so that you don't have any type of billing issues or confusion at the doctor's office. But primarily, most people are concerned with having a reputable, well-named brand, recognized company for a very reasonable premium. That's a supplement plan. Secondary insurance, you're paying more per month. You still have to have Medicare A and B, still pay for Medicare, and you purchase supplement in addition to that to cover that 20% for you and take away that financial risk. The third option of Medicare works a little bit differently. It's called a Medicare Advantage plan. Some people will call it Part C of Medicare. Most people call it an Advantage plan, the same thing. What an Advantage plan does is this is an insurance company that contracts with Medicare to become your primary insurance. You still have to have Medicare A and B to be enrolled in a Medicare Advantage plan, but the structure is a little bit different. This Advantage plan will bundle together A, B, and D all under one, call it an insurance umbrella. And what they'll do is they will replace the deductibles and that 80%, 20% cost structure with fixed copayments or fixed dollar amounts whenever you get a service done. So you'll have a fixed contracted amount to see a primary care doctor, to see a specialist if you go to the hospital, and et cetera, so on and so forth. It comes with the Part D included or embedded with the plan. Now, this type of insurance works very similar to most employer and group insurance type companies, where you have like HMO and PPO. We'll talk a little bit more about it in a few minutes. One thing to be aware of what an Advantage plan is and what it does, this Advantage plan will go out, this insurance company will go out and they will contract with a network of doctors, specialists, hospitals that you can go to. It's important that if you're electing Advantage plan, you want to be looking at a few things. If you have any doctors or facilities that are very important to you, which Advantage plan, which insurance company is going to have those doctors and facilities in network? That's just insurance terminology, meaning that that doctor accepts that insurance. Just because a doctor accepts Medicare doesn't mean they take a Medicare Advantage plan. In addition to checking your doctors, you want to ensure that any prescriptions that you take or are currently taking are currently covered, and which Advantage plans are going to give you the most affordable rate or copayment for your prescriptions, as well as being comfortable with the medical copayments on the plan. It is a pay-as-you-go plan versus a supplement is you're going to pay up front and have everything paid for. The Advantage plan is still pay-as-you-go. One of the benefits of this type of coverage, you truly are protecting yourself from that financial exposure of 20% of all of your bills. And you're not paying as high of a monthly fee to get the protection. In some areas, the Advantage plans will start at $0 a month. You don't pay anything in addition. However, you do still pay your Medicare premiums. And the Medicare premiums, again, those are going to be with you. You'll have to pay those no matter which of these options that you choose. And so to sum up really the entire crash course of how Medicare works and what the coverage options are, original Medicare, you're going to pay 20% of all of your bills. You pick a separate Part D plan that you pay for drug coverage. You can purchase a Medicare supplement and have full coverage, full flexibility. You don't have any medical costs. You can see any doctor, but you will pay more up front in the form of a monthly premium to the insurance company. Still need to get a separate Part D plan on the side. And then your third option being the Medicare Advantage plan, or of a replacement plan. You're going to have fixed dollar amounts, everything bundled together under one insurance, lower monthly premiums, but a pay-as-you-go type structure with a network of doctors. And so with that, we'll
Jim,
move forward. Yeah.
Jim, I see more clients talking about their supplement plans. How often do you see the people you work with go with the Medicare Advantage option?
That's a great question. It really is. I'm not going to say that one's better than the other. It's a personal preference. It's never a one-size-fits-all. I would say that with our Raymond James clients, we're typically dealing with a clientele who has planned in their life, who want protection of their assets, and so paying for a supplement makes sense. They want that extra protection and freedom and flexibility. Probably between 80 and 90% of our clientele through Raymond James partnership goes with the Medicare supplement, but that's not to say that Medicare Advantage plans don't have their place. You know, I mean, there are so many senior citizens out there where all they get every month is a Social Security check, $1,100, right? And they've got a mortgage and a cell phone and bills to pay, and paying that $150, $200 extra for a supplement just doesn't make sense. And so that, you know, both are good coverages. I think staying with original Medicare is very risky in the sense that you have that exposure to 20% of all your bills. Does that help?
Okay. Yes, thank you. That makes sense.
At HP1, we do both, and we try to be as unbiased and give consultative advice on really what type of coverage you need. And I'll dive a little bit more into when and how to sign up and things to look out for.
Cool. Thank you.
The next few slides are reiterating some of what I talked about with Medicare Part A and what it covers, Medical Part B. But I wanted to stop and take a minute going through what you're going to pay for Medicare, what your premiums are for Medicare. The standard premium for most people is $134 per month. That's for Medicare Part B. Part A, in most cases, is considered premium free. You don't have to pay for it every month because most people have paid taxes in this country. And as long as you or a spouse has worked for 10 years in this country and paid taxes, then you don't have to pay for Medicare Part A. Everyone pays for Part B. Now, this slide is important because if you make or have made above certain income limits, Medicare will assess a surcharge to your Medicare premium. On this slide, you'll see it as IRMAA or IRMA. That is Income-Related Monthly Adjustment Amount. And what that's saying is that whether you file individually or jointly on this chart, when you look back, Medicare will look back to your tax return from 2 years ago, and wherever you fall in this bracket, the column all the way over to the right is going to be your Medicare Part B premium. You can see that the most that you would ever pay individually is if you made greater than $214,000 filing individually in 2016, or greater than $428,000 filing jointly in 2016. Your 2018 premium is $428.60.
And this is a chart that we're very aware of at the center. Anytime we make a planning recommendation that increases a client's income, we're checking this chart to make sure we're not going to bump you up into a different bracket and increase your Medicare premium in the future.
That's a very good point. And in addition to that, your premium can go down later in life. So, you know, at age 65, you retire, and they're looking at the tax return from 2 years ago. You know, the following year, they would look at 2017, and in 2020, they would look at 2018, the year you retire. Your income may be less, and so you could see your premium drop substantially.
Yes, good point. Thank you.
So we'll spend the next couple of slides covering just Part D. Again, D stands for drug coverage. Now, Medicare regulates and sets the rules that all insurance carriers and providers must follow when offering Part D insurance. And this is what we're going to cover reigns true in standalone Part D, if you're sticking with original Medicare, or if you're going Medicare plus a supplement and you get a Part D on the side, or if you go with a Medicare Advantage plan with Part D built in. Every Part D insurance is required to offer prescriptions for every known and approved diagnosis in the United States. The costs will vary. The premiums will be different, and what you pay for your prescriptions could be different. Typically, under every plan, it's broken up into tier levels. We'll call it ladders, right, where your lowest ladder, your lowest tier, tier 1, is going to typically be your preferred generic medications, common cholesterol, blood pressure medications. And under any plan, those are going to be very affordable. A few dollars here and there, some offer them for $0. As you get higher up into the tiers, we talk about brand drugs, and the co-payments for you are going to be higher. Whether someone purchases a supplement plan or an advantage plan, a common question that we get is, I would rather pay more upfront and have all of my medications covered in full. Unfortunately, that coverage doesn't exist. While it does exist for medical coverage where you have no medical costs or co-payments, when it comes to prescriptions, every plan is going to have co-payments, more commonly on the brand medications. At HP1, we can tailor a Part D insurance for you or a Medicare Advantage plan for you, punch in any prescriptions that you take into our system, and be able to tell you, based on what you take, here's going to be the insurance plan that saves you the most amount of money, taking into account any premiums or monthly fees, any deductibles, and what you're going to pay for those prescriptions every month. A very common question and conversations that we have every day surround a coverage level within every Part D and within every Advantage plan called the donut hole. The donut hole is a slang term. It's also called the coverage gap. And again, every plan has this. I just want to touch on it and explain it at a 10,000-foot view. Medicare tells insurance companies and sets the law that every insurance company offering Part D or an Advantage plan is required to give you a certain amount of drug coverage every calendar year. When the total cost of your medications under any plan reaches that limit, right now it's $3,750, that is what you pay as your co-payment, being a member of the plan, plus the insurance company. So when the total cost of the medications that you take in a year reaches $3,750, your cost structure changes. You go into the next phase of coverage. And so you'll see your co-payments or the cost of your medications change if you use up that much coverage. You'll go from a set co-payment amount to a percentage. When you go in this donut hole or coverage gap, you will pay for 35% of the cost of brand name drugs and 44% of the cost of generic drugs. There is light at the end of the tunnel. Most of the time when someone goes into the coverage gap or the donut hole, their costs are going up on that percentage base versus their co-payment. Every now and then you find a medication where it does go down. When your costs reach $5,000 in a year, if it were to happen, you go into the final phase of coverage for the remainder of the year, and it is called catastrophic coverage. When you are in that final phase, you will either pay 5% of the cost of the medication, or if it's a generic, $3.35 or $8.35 for brands. It's going to be whichever is greater, 5% or those co-payments. An example,
Jim,
yes.
Prior to a client hitting that donut hole or that coverage gap, what's the typical range that someone would put out in deductibles and co-payments?
Okay, good question. It depends on the medications is the easiest answer. If it's generic medications that someone's taking, we typically don't have someone purchasing a big, expensive, fancy plan, $100 plan premium. You can get a plan for typically between $20 and $30 a month, and that's your monthly fee, where generics are going to be covered at $5 or less. And so a lot of plans will have $0 copay for a lot of generics. If we talk to a client that only takes some generic medications, oftentimes they're paying a few dollars here and there per month and $20, $25 for their plan premium. The more expensive ones you find are new medications, a lot of medications that you see on commercials on TV that don't have generics out yet, or a lot of insulin and expensive medications like that will fall in the brand category. And so typically you'll find between a $45 and $100 copayment for a 1-month supply on brand drugs, depending on what it is. So we have, with having Part D or with having an Advantage plan, you can have someone that pays, $140 for the entire year, and that's really just their plan premium for the year. And you also may have a client that they spend $2,000 or $3,000 a year based on their medications.
Okay.
It depends.
Yeah, that's good to know.
Yeah. So and with the donut hole, every plan has it. We can give strategies to try to prolong going in there. It's not a fix-all, but there is a website out there called goodrx.com. It's just a discount coupon website, and sometimes you'll find if someone's in that donut hole that they can just go on that website and punch in the name of their medication and actually get it for cheaper by just printing off the coupon, and it's free. So that's a helpful tip. If you find yourself in that scenario as well, a lot of people will ask their doctors if they have any samples. That doesn't count against them. They can use that, and it's free. So there's that.
Okay. Great. Thank you.
No problem. Okay. We talked about original Medicare. The next couple slides just reiterate it doesn't cover everything. It will cover 80% of medical bills. Again, doesn't cover prescriptions. A lot of common questions we receive are, does Medicare or do supplement plans, do they cover dental, vision, hearing? And the answer is, more often than not, no. The traditional sense of dental coverage is not covered by Medicare. If it was deemed medically necessary, an example I use is if you had a tumor in your mouth and a dentist had to extract a tooth to get to the tumor, then that would be medically necessary, 80% covered under Medicare. But your traditional crowns, root canals, dentures, vision coverage is not covered. HP1 does contract with multiple carriers that offer that type of insurance that we can package with a supplement or with an Advantage plan. Some of the Advantage plans, those all-in-one plans, will have preventative dental built in or a little bit of a vision allowance, but in general, Medicare and the plans do not cover that either. I want to spend a little time going over some specifics on a Medicare Advantage plan. And this is very important if you're already on Medicare and on a supplement plan, or if you're coming into Medicare and you're considering a Medicare supplement plan. Early in the presentation, I mentioned that a supplement plan is a secondary insurance where you pay a premium every month, and they'll cover everything Medicare doesn't, deductibles and the 20%, so you have no out-of-pocket costs. To keep it simple in that explanation, what I explained was actually one coverage level of a supplement, and it's called Plan F. F stands for full coverage. And there's a reason I'm bringing this up now, because that is not actually the greatest value in our opinion, and I want to give a few reasons why that you can take away. When we talk about this, and on this chart, when you see a yes means that if you purchase this supplement, and if you look at column F, you see yeses down the board. A yes means the insurance company covers it, and you are not responsible for it as the beneficiary. F is considered the Cadillac of plans, meaning it pays everything. But I want to talk a little bit about Plan G. At HP1, we say that Plan G stands for greater value. On this chart, you'll notice that the only difference between Plan F and Plan G when talking about a Medicare supplement is the Part B deductible. So if you go with a Plan G, you are responsible for paying the first $183 to your doctor visits or for medical work every year. After you meet your $183, it becomes exactly like a Plan F, and it pays all of your medical bills the rest of the year. The name of the game is, if you look at the math and you're shopping for insurance and you see that, what is the difference between the premium and what I'm going to pay for Plan F and Plan G? Obviously, Plan F is going to cost the most because it's full coverage. If you can save more than $183 a year in your premium difference between F and G, why pay an insurance company extra money just to pay that deductible for you? I mean, even use the math of $20 a month in difference, $240 a year. Why pay $240 knowing that they're only paying $183 for me? And you will always find that Plan G actually saves you more money than Plan F. But that is not the main reason of why G is going to be or is a greater value. Plan F, if you haven't heard already, in the year 2020, Plan F is going to cease all enrollment. No new members can ever join a Plan F after January 1st, 2020. And the reason being, it's in an effort to save Medicare money. Let's take an individual that has a Plan F and really is very healthy, very rarely goes to the doctor. And that person knows that it's considered first dollar coverage. The supplement picks up right away. If that person gets a finger cut, or a paper cut, I'm sorry, and it's just growing back a little weird, they want to get it checked out, if they have Plan F, they're very likely to go to the doctor and just have them look at it, knowing they don't have to pay anything. Medicare's on the hook for 80% of that bill. If that same person is on Plan G and never goes to the doctor and they get a paper cut, knowing that they have to come out of pocket, say $100 before their deductible is met, they're a lot less likely to go for the small stuff. And so that's why Medicare is ceasing that enrollment. What does that mean? What that means is that if you are already on a Plan F, you will be allowed, you'll be grandfathered into staying on that Plan F. However, your rate increases, the premiums are going to skyrocket. We already know it's going to happen. Plan F will not have any new members coming in after 2020 to offset the cost of, call it an aging book of business, right? As everyone on their plans gets older, it will cost more to insure them. And so to cover those costs, the Plan F insurance companies will have to raise their rates. This happened a few years ago. If you're looking at the chart, you'll see that there is no Plan J. This happened a few years ago. They ceased enrollment into Plan J, and anyone on Plan J could stay on. However, their rates really increased substantially. Plan G is not going away. They have the most stable rate increases already for various reasons we don't have time to go into today. But Plan G is very stable rate increases. You're already saving money. So it's very important to make the right decision up front. If you're on Plan F, don't panic. There may be time to change, and we're going to talk in just a few minutes about when and how to change a supplement plan, as well as an Advantage plan or a prescription drug plan. Taking one step back and going back to Medicare Advantage plans, these are the network-based replacement plans with co-payments. Like I said, they're very similar to employer group coverage. If this is the route that someone's wanting to go with, we can certainly help in finding this type of coverage as well. You primarily have two types of Advantage plans, and I just want to highlight a couple of the differences. Again, I don't know that one's better than the other. You're going to have HMO and PPO with your Medicare Advantage plan. The private fee-for-service is really, I'll call it a dying breed. They're very rare. I think it's less than 2% of the population is involved with that type of plan. An HMO Advantage plan is going to be your more restrictive type plans. Most HMOs require a referral from your primary care doctor before you see a specialist. And you have to stay inside the contracted network of doctors that insurance company has. If you go outside of the network, you're going to pay for 100% of the bill yourself, unless it is an emergency. Emergencies are covered nationwide at the in-network rate. Okay? But an HMO, more restrictive in that you need referrals and you have to stay in the network. Because they're more restrictive, they're going to be your most affordable plans. You're going to have your lowest premiums. They're going to have lower co-payments when you get services done versus a PPO. A PPO, or Preferred Provider Organization, is still going to have a network of doctors, but you are allowed to go outside of the network. Now, if you go out of the network, your co-payment or your cost will be higher than staying in the network. You also do not need any referrals with a PPO. So PPO is going to give you more freedom and flexibility, but you're also going to pay more in the form of either a higher premium or a higher co-payment. Contrary to a Medicare supplement, which is really your most comprehensive coverage, you can see any doctor that accepts Medicare. You're not dealing with negotiated rates with a supplement. With an Advantage plan, you are. Again, it's what's important to someone. Is the goal saving the most amount of money possible and keeping the cost as low as possible? Let's say go HMO in most circumstances. Having a little more freedom and flexibility, don't mind paying a little more, PPO. when we talk and decide that a Medicare Advantage plan is the right route for somebody. So I'm going to spend a couple minutes just going through when someone signs up and when they're eligible for Medicare or an Advantage plan. Very important relative to our time frame now going into October. Right now you may see the commercials all over the TV or be getting flyers and mailers talking about open enrollment and annual enrollment and changing your plan. Every year anyone on Medicare can change their Medicare Advantage plan or their prescription drug plan during annual enrollment. This runs October 15th to December 7th every year. And if you make an election during this time frame, any changes you make to your Advantage plan or to your Part D plan will take effect January 1st, 2019. Outside of this time frame, if you're ever wanting to change your drug plan or Part D or your Advantage plan, you have to have what's considered a special election period. It just is insurance mumbo jumbo, meaning you have a special circumstance to change your plan outside of annual enrollment. Most common one we come across is a recent mover. If someone moves out of a service area, they get a 2-month window to change their plan. Being hospitalized or in a recovery facility for 90 days or more, oftentimes someone's medical scenario changes substantially when that happens with prescriptions. So if it's an expected stay of 90 days, that would allow someone to change. A very common one is on the slide. It's called your initial enrollment period. And so when you are first eligible for Medicare, you first sign up for Medicare Part A and B, you get 3 months before, the month of, and 3 months after your 65th birthday or your Medicare effective date. You can make changes or elections during that time frame as well. Losing employer or group coverage is another one that gives that special circumstance. So if you're not sure and you find yourself next year in a circumstance you need to change, call in to us. We'll give our phone number at the end of the presentation. We'll help you navigate on if you can qualify to change your drug plan or your Advantage plan. This is different than a Medicare supplement plan. And it's a very common misconception or common question that we get. Someone thinks that they may only be able to change their Medicare supplement or their Medigap plan during annual enrollment, and that is not true. You can change your supplement plan anytime you want throughout the year. But if you ever want to change your supplement plan, or if you ever want to join a supplement plan, you have to go through a series of underwriting health questions. Typically, most insurance companies are going to ask between 15 and 20 health questions. And if you answer yes to any of those health questions, more oftentimes than not, you are not eligible to join a Medicare supplement plan. In some circumstances, you can join if you answer yes to any health questions. Your rate is going to be, or your premium is going to be substantially higher. There are 1 or 2 states that offer what's called guaranteed issue supplement plans, the state of New York being one, where they allow anyone to come in and join. Their rates are a lot higher. A common question I get is, I thought with healthcare reform and the Affordable Care Act that there was no such thing as pre-existing conditions with insurance. And that is true of primary insurance companies, Medicare being your primary insurance or an Advantage plan or the Affordable Care Act marketplace. When dealing with a supplement, again, it's a secondary insurance, and they don't have to follow all of those same rules that primary insurance companies do. It's important that we cover a couple things. When you're first eligible for Medicare, no matter what state you're in, you do have a 6-month window from your Medicare effective date, and it'll say it on your Medicare card when your Medicare started. You get 6 months where you can join any supplement plan that you want, and you are guaranteed acceptance into any coverage you want at the preferred rate. So if you're aging into Medicare and listening to this presentation, knowing you've got a lot of medical conditions or pre-existing conditions, very important that you consider a Medicare supplement plan. If you are on a Medicare supplement plan F and hearing the presentation, understanding the rates are going to increase after 2020, you want to switch. We typically advise that you do it while you can qualify and while you can switch and answer no to those health questions. And we're not talking health questions about blood pressure, cholesterol, and common things like that. We're talking about upcoming surgeries, a lot of recent hospitalizations, mental health, serious heart conditions or lung conditions, things like that. If you're unsure, please call into us. We'll walk you through if you're eligible to change. So those are just common things and questions about signing up. Now, it's not on the slide, but I want to talk just for a second, if I may, about signing up for Medicare by, A and B. Again, you have to have A and B no matter which of these coverage options you want to choose. If you reach age 65, Medicare is available to people age 65 or older, or if you're under 65 and you're receiving Social Security disability benefits for 2 years, you're also eligible. Most people at age 65. If you tell Social Security that you are going to take Social Security retirement benefits at age 65, you will automatically be enrolled into Medicare A and B. You'll get a card. Contrary, if you tell Social Security that I'm going to delay my Social Security benefits, you will not be enrolled into Medicare, but you can still apply for Medicare. You just have to physically do it. You can apply online at socialsecurity.gov or go to your local Social Security office and apply for Medicare A and B at age 65 if you're delaying your Social Security retirement benefits. Last point on that is if you're taking retirement benefits early, say at age 63, you will not be enrolled into Medicare at age 63 unless you're on disability benefits. It will automatically trigger for you at age 65. You can call us in and we'll do analysis if you have group insurance and you want to keep working or your spouse is continuing to work, and if you want to say, hey, what are my options under Medicare? What kind of prices am I looking at for a supplement plan? Should I stay on my group insurance? Should I sign up for Medicare A and B even though I have group insurance? Those are all great questions to call in and ask for us. That is covered on this slide right here. Okay, lastly, and this kind of comes on the coattails of signing up for Medicare. We get a lot of questions and conversations about penalties. Do I have to sign up for Medicare? Do I have to have Part D? I'm not taking any prescriptions. There's no law stating that you have to sign up for a Part D insurance or that you have to get an Advantage plan with drug coverage. But understand, if you go on Medicare and you do not elect or you do not maintain drug coverage, later in life, if you want to sign up for prescription drug coverage for an Advantage plan, because your situation's changed and your doctor may have prescribed an expensive medication, Medicare will assess a penalty. And the penalty goes for however long you've been on Medicare without any type of drug coverage. It will be larger the longer you go without drug coverage. You can avoid this penalty if you can prove to Social Security that you have had other credible coverage. We're talking VA benefits or group insurance that has drug coverage. They'll waive the penalty. The same goes for Part B. If you've had group insurance and it's deemed credible, your benefits coordinator or the office that answers questions about your insurance can help you with this on making sure your insurance is credible. If you can prove that I've had this insurance, when you go to sign up for Part B upon retirement or age 69, 70, what have you, they'll waive any type of penalty.
Can you explain the difference between the flat amount and the incremental a little more in depth? Are the incremental penalties, is that compounding for each month or year you don't have the coverage?
Very good. It's not a compound interest, it's a simple interest, but it is larger. The difference is when you see under Part A the flat amount is, hey, I didn't work my 40 quarters or my 10 years. Here's what my premium or penalty is going to be for Part A. It's flat. It's not larger if you've gone without Medicare for a certain amount of time. It's just based on the amount of time that you've paid into Medicare as a tax-paying citizen. The incremental figures for Part B and Part D state that if you are 65 and you're eligible for Medicare, the longer that you wait without getting Part B or the longer that you wait without getting Part D, if you sign up for either of those coverages later in life, it's going to be a larger penalty, and the penalty stays with you. I'll give a brief example. You're 65, you elect to just get a supplement, you don't take any medications, and so you don't want to pay for Part D. 3 years down the road, doctor prescribes an expensive medication, you want to get a Part D to help you. So you've been on Medicare for 3 years without any form of drug coverage. The drug coverage penalty, you'll see the wording on here. Let's just make it easy. It's about 35 cents for every month you're on Medicare without drug coverage. So if you go a year, you're looking between $3 and $4. 3 years without it is $12. that penalty is not a one-time penalty. It's tacked on to your monthly premium when you're signed up for drug coverage for the rest of your life. And the same applies to Medicare Part B.
So it'd be an additional $12 a month for the rest of your life?
Correct. More or less. Those are approximate numbers, but yes, ma'am.
Yeah, okay. Thank you.
Okay. You're welcome. Now again, if you can prove that you've had group coverage or other drug coverage or medical coverage while 65 or older, then those penalties will be waived. If you have any questions about penalties, feel free to call into our office. A little bit about HP1 and our relationship with Raymond James. We're very selective in who we bring in. We hire less than 20% of all applicants that come in to be consultants and Medicare agents. We actually have very recently expanded into a Connecticut office. They're not on this presentation because those are very new agents and new consultants. The relationships with Raymond James and HP1 is very delicate. We know that we're dealing with typically individuals who are higher net worth that have a very trusting relationship with their financial advisor. So when a financial advisor is telling someone, hey, call HP1, they're going to really take care of you, we want to make sure that your clients that all of you all are receiving the best service and the best agents and the best advice that we have to offer. We have less than 10% of our staff skilled to take any Raymond James client. So we'll give you our dedicated line in just a minute here. When you call in, the phone number that you're dialing is only being routed to our best of the best, agents that have years and years of experience that really give sound advice. We very rarely add anyone into this relationship unless we're very confident that they're doing an outstanding job and that every piece of advice they're giving is outstanding and excellent. So you're getting the best that we have to offer at HP1. Lastly, it's just an example of a lot of the different insurance companies that we contract with. You'll see all the major names on here: United Healthcare, Aetna, Humana, Blue Cross Blue Shield, Cigna, Mutual of Omaha, AARP. This is not an all-inclusive list. It's just an idea. We are consultants with you. We want to give consultative advice. We're not paid anything in addition to give you one insurance company over the rest. And this isn't to bash it. If any of you listening have agents out there that help you, it's not to bash them at all, but to just understand that many agencies out there are paid, or field agents, brokers, they're paid based on the premium that they sign you up for. So they may not have shown you Plan G being a greater value than Plan F, because the higher the premium they get you, the more that they're paid. And that's not to say that anyone would or wouldn't do that, but it is out there. It's a common thing. At HP1, our agents are paid the exact same no matter which we do, and no matter what company we put you in. We are a free service for you, and we're here to help you, guide you to the right decision, assist you with finding a plan for you, and can assist you with signing up for the plan. We can walk you all the way through it. Here is our phone number. Callie, I'm going to pass it back to you. Thank you all very much for taking the time listening to the presentation today. Please feel free to call us in if you have any additional questions. Good luck during the annual enrollment period and your search and changing your Medicare options. Let us know if we can help.
Jim, thank you so much. That was definitely a crash course, so much information, and unfortunately we can't take live questions, but those of you who are listening, if you have anything you want a little more information on, or you think of questions after you listen, please feel free to shoot me an email or call our office, 248-948-7900, or call HP1 directly. Like Jim mentioned, this is a dedicated line for Raymond James clients, so there are people there ready to help answer your questions and help you move through the Medicare process. But thank you, everyone, so much for your time. Good luck making your Medicare decisions, and again, please feel free to reach out to us with any questions. Thank you. Have a great day.